السلام عليكم طلاب. الصوت والصورة واضحة. تخش عن المحاضرة تقول لي عنها. طلاب تسمعون صوتي تشاءون المحاضرة. بسم الله الرحمن الرحيم. Today we will start the pathology of the respiratory system, lecture 1. Inshallah, we will try to cover the respiratory pathology in 5 lectures. Today's lecture will include introduction about the respiratory system, and then we will start with the pathologies or the diseases of this system. In this lecture today, we will start with the diseases of the upper respiratory tract that include the nose, the pharynx, tumors of the nose and the sinuses and the nasopharynx, and then the diseases of the larynx. So most of our lecture today is about the upper respiratory tract. As you know, that the respiratory system is a complex of organs and tissues, and the function of this system is to exchange of oxygen and CO2 between the body and the external environment. It classically consists of nasal cavities, okay, and paranasal sinuses connected with the nasal cavities, and then we have the pharynx, which is divided into nasopharynx, oropharynx, and laryngopharynx. Then we will start with the trachea, okay, and the lung. Until the pharynx, we call it upper respiratory tract. This is an anatomical division, and the lower respiratory tract is starting from the larynx and downwards, okay, the trachea, and then the bronchi, bronchioles, terminal bronchioles, respiratory bronchioles, until we reach the alveoli. In the alveoli, the exchange of oxygen and CO2 will occur, okay? And this is the lung, which contains the bronchial tree with the alveolar tissue. Again, we have the diaphragm that assists in the process of respiration, okay? And all these tissues are located in the chest wall, okay? So we will have a brief review about the macroscopic structure of the alveoli or the alveolar walls, which are consisting of the following structure. As you know, this is the lumen of the capillaries where there is deoxygenated blood, okay, and this is the lumen of the alveoli where the oxygen, where the air is present here and contains high concentration of oxygen, and here there is high concentration of CO2, and the process of exchange will occur between these two areas, okay. So we have a network of capillaries lined with endothelial cells. As any other blood vessel, there is endothelial cells, and then we have a basement membrane with interstitial tissue that is beneath the endothelial cells. And then we have the alveolar epithelium, okay? The alveolar epithelium is a continuous layer of two type of cells. The first type called the type 1 pneumocyte, which is a flat epithelial cells, okay? Simple epithelial cells, flat epithelial cells, type 1 pneumocyte, and this is constituting about 95% of the alveolar surface. And also we have a type 2 pneumocytes. These type 2 pneumocytes and are larger cells, rounded cells, and this is scattered cells and rare type of cells that are present in the alveolar walls. In addition to these two type of pneumocytes, we have alveolar macrophages, and we have which are some of them are located in the lumen of the alveoli, and some of them are located between the epithelial cells. And the alveolar spaces are perforated by numerous pores of cohesion, which are permit the passage of bacteria and exudate between the adjacent alveoli. So, in between each alveolus, we have a bypass tract, and this bypass tract is called pores of cohesion. This pores of cohesion connecting the nearby alveoli, so it will equalize the air pressure between the alveoli. Okay. But at the same time, these pores of cohesion represent a tract where there may be passages of bacteria, passages of exudate between the alveoli. So when we have an inflammation or infection in one alveolus, this inflammation may go to a nearby alveolus by these pores. Okay, so they represent a bypass passages between the nearby alveoli. So by these pores of cohesion, we may have a pattern of inflammation that we will call it lobar pneumonia, that we will discuss it inshallah in lecture 4 when we discuss pneumonia. So what is the function of these cells? The function, the more important function of type 2 pneumocyte is the production of surfactant. And this surfactant represent a fluid inside the alveolar spaces that permit that will permit the alveoli to be partially opened, okay? And this partial opening of the alveoli is important in the process of respiration, because if the alveoli is collapsed, we will need a strong force of inspiratory respiration, and this strong force may make the process of respiration is very exhausting to our body. So this surfactant permits the alveoli to be partially opened. So when we have just a brief intake of air inside the respiratory passages, it may reach the alveoli easily. Okay, so this surfactant keep the alveoli partially open. Okay. Also, these type 2 pneumocytes responsible for the repair of the type 1 pneumocyte. So they represent some sort of stem cells that can produce type 1 pneumocyte and also can produce type 2 pneumocyte. So they are responsible for repair of the epithelial cell inside the alveoli, and also they are responsible for the production of the surfactant. So the alveolar blood-air barrier between the blood and the air inside the alveoli or inside the lung is consisting of endothelial cells, consisting of a basement membrane with interstitial tissue, and then it's consisting of pneumocytes, type 1 and type 2 pneumocytes. Through these barriers, the oxygen and CO2 is going to be exchanged through the process of diffusion. There will be diffusion through the cytoplasm of these structures. This diffusion permits the exchange of oxygen and CO2 between these two barriers. Okay, so now after this brief review, we will start our lecture, which is a pathology of the system. Okay, so we are discussing the diseases of the respiratory system. And these diseases, we will start from upward downwards. First of all, we will discuss the nose. What are the pathologies that may occur in the nose? We may have rhinitis. Rhinitis, it means inflammation of the nasal mucosa, okay? And this inflammation is usually accompanied by sinusitis. So when we have inflammation inside the nose, this inflammation is almost always accompanied by inflammation of the sinuses. Why? Because the sinuses are connected to the nasal cavity. So when we have some sort of infection or inflammation inside the nose, it will go easily to the sinuses. So rhinitis and sinusitis are two processes that almost always existing with each other. And this rhinitis could be acute rhinitis or chronic rhinitis. Acute could be specific, like diphtheria that we discussed in the infection lectures, and could be non-specific. For example, common cold, flu, allergic rhinitis. All these are non-specific acute inflammation of the nose. So all of us experience periods of common cold or flu, and we have this catarrhal inflammation. Catarrhal, it means mild inflammation of the nose, okay? Or sometimes allergic, especially in spring. Some people have allergy, so they are sneezing and coughing or at this period of time, so it is called allergic rhinitis. Again, we have some sort of chronic inflammation of the nose, and could be either specific, could sometimes with a granuloma, like tuberculosis, leprosy, syphilis, all these are specific infections, or could be non-specific, such as atrophic or hypertrophic or allergic rhinitis. Again, the allergy could be chronic. Some people have allergy for 1 month, 2 months, or 3 months. So there could be some sort of allergic inflammation. And this chronic inflammation of the nose may result in a polypoid formation inside the nose because of frequent inflammation and healing, inflammation and healing, inflammation and healing. This will result in polypoid projection of the nasal cavity. So the mucosa of the nose will undergo some sort of expansion or polypoid formation. And this polypoid formation is usually covered by benign nasal epithelium, and it is gelatinous in consistency and has a smooth surface, usually bilateral polyps, okay? And it consists of edematous stroma containing blood vessels, containing mucus glands, and they are infiltrated by chronic inflammatory cells, especially the eosinophils, and it is usually resulting from allergic or inflammatory reaction. So this is the stroma with, you can see the edema, you can see this expansion of the stroma, with inflammatory cell infiltration. And you take this slide frequently in the previous lectures, you see there is eosinophils due to allergic inflammation, and this is a respiratory type of epithelium, CD35 columnar ciliated epithelium. So this polypoid projection is called the nasal polyp. If it is due to allergy, we call it allergic nasal polyp. If it is due to any other infection or inflammation, we call just the nasal polyp or inflammatory nasal polyp. Okay, well, how we can differentiate? It's according to the history, and sometimes also the presence of abundant eosinophil suggests that there is allergy rather than other causes of inflammation. Now we come to the sinusitis, and as we said, sinusitis is almost always associated with rhinitis. It is acute inflammation of the nasal sinuses. Usually, it's follow extension of infection or inflammation from the nose or sometimes from the tooth sockets. Even the tooth infection can result in inflammation of the sinuses because it is very close to each other. Etiology could be allergic again or infectious due to viral or bacterial infection. Pathologically, there will be the usual features of acute inflammation. We will have congestion, edema, obstruction of the sinuses, and this resulting in accumulation of the mucus secretion followed by superadded bacterial infection. يعني الأكيوت inflammation عادة يؤدي إلى الإديمة والcongestion والacute inflammatory cell infiltration. But because the opening of the sinuses is narrow open, يعني opening of the sinuses into the nasal cavity is a very narrow areas. This narrow lumen may be obstructed due to these abundant edema and congestion, and this will result in obstruction of the opening of the sinuses. And this obstruction راح يؤدي إلى شنو؟ إلى accumulation of secretion inside the sinuses, and this accumulation of secretion will result in a good area for the growth of bacteria. And sometimes we'll have superadded bacterial infection in addition to allergy or in addition to some sort of viral infection. So this may end with complication, although they are rare, but may occur sometimes osteomyelitis of the bones of the skull, or sometimes abscess formation under the skin, or orbital cellulitis, or sometimes even intracranial separation like meningitis or brain abscess. These complications are rare, but may occur. So usually the early and good treatment of inflammation may result in complete resolution of this process. Okay. So now we will go to the other pathology, which is epistaxis. Epistaxis, it means bleeding from the nose. Okay, and this bleeding could be local cause, trauma to the nose, or sometimes the polyp with extensive growth may undergo some sort of bleeding, or sometimes systemic causes like hypertension, for example, or leukemia, blood disorders, or hemorrhagic disease of the low platelet count, in purpura, and so on, deficiency, vitamin deficiency, vitamin K or C deficiency, sometimes infection like measles or typhoid fever. So it could be local, so to the nose, to the nose, or sometimes it's systemic. So just to know the term epistaxis, it is bleeding from the nose. Okay, we will discuss this term extensively in fifth stage in ENT lectures, inshallah. Now we go to the pharynx. We discuss the nose and then sinuses. We go to the pharynx and pharynx inflammation or the neoplastic processes that may occur in the pharynx. Inflammation of the pharynx we call pharyngitis. Okay, and if it occurs at the area of the tonsils, because the tonsils are present in the oropharynx, we call it tonsillitis. Causes of inflammation of the pharynx either viral upper respiratory tract infection, usually viral cause, rhinovirus, influenza virus. The pathological features as usual, it is redness, edema, okay, with sometimes affecting the tonsil, because as you know, the tonsil, they have the same structure of the lymph node. They contain lymphocytes, they contain lymphoid follicles, so they may also undergo some reactive enlargement of the tonsils and even enlargement of the lymph node of the neck. Okay, the other cause is bacterial infection, and this bacterial infection could be primary from its onset, or sometimes it is a secondary or superadded infection, such as beta hemolytic streptococcal infection or Staph aureus. Pathological features that may occur in this sort of infection, there will be more inflammatory process. There will be exudative membrane formation, pseudomembrane formation. The tonsil will become enlarged and undergo reactive hyperplasia, as we will discuss, the chronic hyperplasia of the lymph node, reactive lymphoid hyperplasia. This may also occur in the tonsil due to bacterial infection, and it is also covered by exudates. Usually, the bacterial, it is more severe features of infection. There will be more exudate formation, more neutrophilic infiltration, more reactive changes in the lymph node, actor than viral infection. The major importance of streptococcal infection is that the possible of the late sequelae. What is the late sequelae? Is the development of rheumatic fever and glomerulonephritis. I think you take it in cardiology, rheumatic fever. It is due to cross-reaction the antibodies are cross-reacting with the tissue of the heart. And you will discuss again the glomerulonephritis in the renal pathology. You will know how there may be some sort of post-streptococcal glomerulonephritis. These are some sort of complication of bacterial infection of the pharynx, and this infection usually and this complication usually due to some strains of beta hemolytic, some strains of the streptococcal infection. Okay, some strains of these bacteria may result in rheumatic fever or glomerulonephritis. Now we will discuss the neoplastic processes of the nose and the sinuses and the nasopharynx. What are the tumors that may occur? We may have either benign or malignant tumors. Benign tumors of the nasopharynx, one of them is called Nedopharyngeal Angiofibroma. Oma, it means benign. Angio, it means vessels. Fibro, it means fibrous. So it is located in the nasopharynx. It is a benign tumor located in the nasopharynx. It's consisting of blood vessels and consisting of fibrous tissue. Okay, so this is the definition from the name. Okay, highly vascularized tumor occurs. This type of tumor exclusively in adolescent male. يعني the studies show that it is only occurring in the male. Exclusively يعني حصري. فقط يصير وين؟ بالadolescent male in the adolescent age, and these male are usually they have red head and fair skin. يعني هذول الناس اللي عندهم شعر الاحمر او الشجر مثل ما نسميهم احنا، هذول شافوا انه عندهم يعني high incidence of this type of tumor يسموها nasopharyngeal angiofibroma. It is usually exclusively in adolescent male يعني ما شافوا يصير بالفيميل، وهذول الميل usually they are fair skinned and red head. Okay. The other type of tumor is called sinonasal papilloma. When we call papilloma, it means a benign tumor that have a papillary-like projection, يعني finger-like projection. Okay, sinonasal papilloma, or sometimes it's called Schneiderian papilloma. It is a benign neoplasm arising from the respiratory mucosa of the nasal cavity and the paranasal sinuses, and this benign neoplasm has a papillary architecture. Why? What is the cause of this papilloma? Usually associated with the human papilloma virus, which is type 6 or type 11, and the pathological features will consisting of papillomatous proliferation of the squamous epithelium. You can see here we have this finger-like projection. Okay, it is covered by benign epithelium, usually squamous epithelium or sometimes respiratory epithelium, and it contains also cytoma. Okay, it is called nasal papilloma because they have the picture or the structure of the papillae. Okay. Here, on the other hand, we have this Nedopharyngeal Angiofibroma, grossly. It is firm, whitish in color, homogeneous in color. This is the Nedopharyngeal Angiofibroma. And here, this tumor, it is composed of a blood vessel, okay, and fibrous tissue. So it is fibrous tissue with a blood vessel. We call it angiofibroma. It is blood vessel with fibrous tissue. The other tumor is called olfactory neuroblastoma. Although it is aimed with oma, but it is a malignant tumor. It is some sort of malignant neuroectodermal tumor arising from the neuroectodermal olfactory cells which are present within the mucosa, particularly in the superior aspect of the nasal cavity. As you know from the normal histology, that the nasal cavity, the upper aspect and the upper roof of the nasal cavity contain olfactory epithelium. And these olfactory epithelium are responsible for smell. Okay, they have sensory nerves that are responsible for olfaction and for the smelling process. Okay, they are connected with the olfactory nerve of the tip-on of the cranial nerve. This type of tumor, it is a malignant tumor arising from these type of epithelium, arising from the olfactory epithelium, which are present in the superior aspect of the nasal cavity. So we call it olfactory neuroblastoma, but it is unfortunately, it is a malignant tumor. Okay, it has bimodal age distribution, and one peak at the age of 15 and the other at the age of 50. So we can see it in the young people, and we can see it in the elderly people. The usual presentation is epistaxis and nasal obstruction because this is will undergo rapid growth, and so this rapid growth may result in bleeding and also may result in obstruction of the nose. Histologically, the olfactory epithelium are composed of nest and lobules of filled circumscribed cells that are separated by fibrovascular system. So these are the malignant cells. They have some features that are like the lymphocyte يعني تشبه الليمفوسايت أو تشبه neuroendocrine tumors because they are small round blue cell tumor. Okay, they are growing as nests. Okay, they are separated by fibrovascular trauma, but these nests are invasive. They can undergo destruction of the underlying tissue. This is the respiratory epithelium, and this is the malignant nest of these type of neuroectodermal cells. So it is called olfactory neuroblastoma, arising usually from the olfactory epithelium and the superior aspect of the nasal cavity. The other type of malignant tumor that occurs in the nasopharynx is called Nedopharyngeal Carcinoma. It is very common. It is rare neoplasm, but it has a strong link to the Epstein-Barr virus. But it is common in Chinese. So it is not common here. It is common in China and Southeast Asia, but in our locality it is rare. It is usually linked to the EBV virus. Okay, يعني one of the risk factors for this type of tumor is EBV, like Burkitt's lymphoma, مثل ما أخذنا بالهوشين lymphoma, and other some sort of lymphoma. They have linked with the EBV virus because the EBV virus one of the oncogenic viruses. يعني واحدة من الفيروسات اللي ممكن predispose for tumors. من ضمن هذه التيومرز هي الليمفوما مثل البركت والهوشكين أو النيزوفارنجيال carcinoma. This nasopharyngeal carcinoma morphologically having three types or three variants. Either it is presented as keratinizing squamous cell carcinoma or non-keratinizing squamous cell carcinoma, or it is presented as undifferentiated carcinoma. When we call it undifferentiated, we mean there is no specific features. Undifferentiated, there is no differentiation. يعني there is no morphology. يعني there is no resemblance to any normal morphology. نحكي على differentiation معناتها the level of the degree or the degree of similarity of the tumor to the normal tissue. من نحكي undifferentiated معناتها هذا الtumor usually he will not resemble any other normal tissue. So it is composed of large malignant cells with marked infiltration with lymphocytes. It is a radiosensitive tumor. The 5-year survival is 50% even for advanced tumor. This tumor يعني the usual treatment for it is by radiation because it is sensitive to radiation. The 5-year survival عادة تكون poor survival 50% even for advanced malignancy. You can see this is يعني بنحكي على differentiation. هنا يعني نقدر نشبه هذا التيومر بالسكويموس cell carcinoma with areas of keratinization because the features are like the squamous cell, even they are haphazard and malignant cells, but we can have some degree of similarity to the squamous epithelium. So it is called here keratinizing squamous cell carcinoma. Here it is non-keratinizing squamous cell carcinoma because there is no keratin formation, but still the cells having some degree of similarity to the squamous epithelium. Here it is the undifferentiated. Why it is undifferentiated? Because these are the malignant cells. They didn't resemble any other type of huge normal epithelial cells in the body. So they are called undifferentiated cells, malignant cells with the characteristic feature there is infiltration of lymphocyte around these type of malignant cells. So either the nasopharyngeal carcinoma, either it is by keratinizing squamous cell carcinoma, unkeratinizing squamous cell carcinoma, or they are undifferentiated carcinoma. All of these are linked to the EBV virus, Epstein-Barr virus, which is one of the oncogenic viruses in the body. Now, we finished the pharynx and the nose and the nasal sinuses and يعني the nose and sinuses with nasopharyngeal area. Okay. Now we will go to the larynx. Okay. We go to the other structure, which is the larynx. As you know, the larynx is the structure in the lower end of the pharynx, sometimes called laryngopharynx. Okay. And it is responsible for phonation. Also, it is responsible for the control of passages of food through the process of swallowing, and by the presence of epiglottis, it will prevent this food from going to the respiratory passages. And also we have the vocal cord, which are responsible for the production of sound. Okay, so the diseases of the larynx, it is either laryngitis, an inflammatory process of the larynx, we call it laryngitis, or we may have some sort of tumors. We will discuss them, inshallah. So laryngitis, what we mean by laryngitis? Laryngitis, it is either acute or chronic process. يعني laryngitis, it means inflammation of the larynx. And this inflammation, either acute inflammation or it could be a chronic inflammation. Okay? Why we have inflammation in the larynx? The inflammation of the larynx it could be due to, as usual, viral, bacterial infection, allergic reaction, and chemical, sometimes chemical irritation in the larynx may result in laryngitis. Okay? More commonly it is part of generalized upper respiratory tract infection. يعني rarely انه ناخذ عندنا مريض فقط عنده laryngitis. Usually من يجي مريض عنده laryngitis عنده وياها pharyngitis او عنده rhinitis لانه مرات احنا كلها نسميها upper respiratory tract infection خاصه بالاطفال يجون يعني مثل ما نقول inflammation من النوز الى حد الفارنج ولا كله لانه منطقه قريبه من منطقه ومنطقه ممكن تعدي منطقه. فاذا الupper respiratory tract infection هو المور common presentation و sometimes بيكون localized اذا كان يعني other cause. ايضا الكوزز اوف laryngitis هو من الانفيرمنتال توكسين خاصه التوباكو سموكينج يعني عمليه التدخين هذه ايضا تاثر على اللارنج. تلاحظ كثير من المدخنين عندهم بحه بالصوت او عندهم مشاكل في منطقه اللارنج. ايضا other cause of inflammation of the larynx هو excessive use of voice يعني الاشخاص اللي يستخدمون صوتهم بكثره زين مثل احنا نسميهم التيتشرز زين الاساتذه الجامعات مدرسين المدارس ايضا عند النساء بشكل عام لانه صوتهم يكون عاده عالي يستخدمون صوتهم بكثره. ايضا المغنين يعني والمقدمين البرامج وغيرهم هذول. لذلك احنا ممكن يكون عندنا هذا الاكسسيف يوز اوف فويس راح يؤدي الى اكسسيف يوز اوف ذا فوكال كورد يعني الحبال الصوتيه تستخدم بكثره وهذا الاستخدام الكثير للحبال الصوتيه احيانا مو دائما احيانا راح يؤدي الى محض الاريتيشن زين بالفوكال كورد وهذا الاريتيشن راح يؤدي الى thickening and polypoid mass formation. Okay, and this is what we call it laryngeal polyp. فراح تؤدي الى نتوءات باللارنكس بسبب شنو؟ بسبب الاستخدام المفرط للصوت زين فهذا النتوءات اللي تتكون بسبب شنو الاحتكاك اللي يصير بالفوكال كورد بين الفوكال كورد وبين الهواء راح يصير مع بعض الاحتكاك. هذا الاحتكاك راح يؤدي الى thickening واحيانا يؤدي الى polyp formation. فهذا البوليب احنا نسميها laryngeal polyp او نسميها singers nodule. ليش سموها singer nodule؟ لانه نسبه الى السينجرز او نسبه الى الاشخاص اللي يستخدمون اصواتهم بكثره. فهذا هو صح هو benign polyp او benign mass بس هي سبب مالتها هو inflammatory process اللي تؤدي الى polypoid formation. احيانا يكون الانفلاميشن باللارynx سببه gastroesophageal reflux زين. احيانا بعض الناس عندهم ارتجاع من المريء. هذا الارتجاع من المريء طبعا يحتوي المواد الحامضيه في المعده راح تروح وين؟ الى منطقه البلعوم منطقه الفارنكس واللارنكس وهذا يؤدي الى irritation لانه الاسيديتي مال الستومك عاده تكون كلش عاليه ما تتحملها الميوكوزا مال اللارنكس فاحيانا نسوي لنا ايضا لارنجايتس الاشخاص اللي عندهم رفلكس. ايضا احيانا يكون سببها سيستميك انفكشن التهاب كل جسم الانسان مثل tuberculosis او الديفتيريا. فهاي كلها من الكوزز اللي ممكن تسوي لنا laryngitis whether acute او chronic. We have some important term اللي ان شاء الله تاخذوه في صف خامس في البيدياتريك باثولوجي او في البيدياتريك يعني البيدياتريك لكتشرز اللي هو الكروب. زين الكروب هو very common condition تصير خاصه عند الاطفال. زين الكروب هو الاذر نيم فور وات فور لارنجيو ايبيجلوتايتس. زين فاذا هو التهاب ايتس. طبعا تعرفون الايتس هو انفلاميشن. ايتس مثل ما نقول لارنكس لارنجايتس يعني انفلاميشن. الايتس هو انفلاميشن. اوكي انفلاميشن اوف وات؟ inflammation of the larynx with the epiglottis. The epiglottis هي part of the larynx. فإذا راح يصير عندنا inflammation في كل اللارنكس من اللارنكس إلى الإبيجلوتس نسميها laryngeal epiglottitis. زين هذا الانفلاميشن سببه infection by respiratory syncytial virus أو by Haemophilus influenza أو by beta hemolytic streptococcus. These يعني three microorganisms are the usual cause for this type of infection. Okay. And this infection will result in sudden swelling of the epiglottis and the vocal cord with laryngeal obstruction. هذا النوع من الانفكشن يسوي لنا طبعا نتيجه الانفلاميشن راح يصير عندنا swelling بالابيجلوتس swelling بالvocal cord وهذا راح يؤدي الى انسداد او تضيق في مجرى اللارنكس. زين هذا اللارنجيال obstruction او هذا اللارنجيال narrowing راح يكون يعني dangerous بالنسبه للانفنت واليونج children. ليش؟ لانه الانفنت واليونج children النورمال اناتومي والنورمال ايرويز مالتهم بتكون عاده نارو يعني عند الاطفال هاي المنطقه منطقه اللارنكس هي very narrow. زين. ف any sort of inflammation, any infection, any swelling in this area راح راسا يؤدي الى obstruction. زين. راح يؤدي الى obstruction او يؤدي الى narrowing. فطبعا الطفل خاصه عمره سنه او عمره 6 شهور او حتى السنتين، زين، اي انسداد او اي تضيق في اللارynx وهو ما يعرف طبعا يعبر عن نفسه، راح فقط كراينج، ممكن يعني الاهل ما ينتبهوا لهذا الموضوع. فطبعا فيري دينجرس خاصه بالاطفال، فدائما تحتاج الى يعني الميديكال امرجنسي، تعتبر يعني حاله طارئه وتستوجب الدخول الى الطوارئ او الى المستشفى. وهاي الحاله راح ان شاء الله يعني حتناقشوها بالبيدياتريك، يعني بالبيدياتريك لكتشر. وايضا راح تشوفوها كثير في حاله الطوارئ، راح يجي المريض يحتاج بخاخ، يحتاج تبخير، يحتاج الى بعض الادويه مثل الستيرويد، زين، انجكشن، حتى يقلل من الاديمه والانفلاميشن، وبالتالي يحفز يعني والاكسجين ايضا حتى يسمح بمرور الهواء ومن ثم التنفس بشكل طبيعي. ممكن تصير الحاله هاي بالاكبر، نعم ممكن تصير بالناس الاكبر سنا، لكن عاده ما تؤدي الى يعني يعني ما تؤدي الى الاختناق، او ما تؤدي الى الديزنيا، او ما تحتاج احيانا الى هوسبيتال ادميشن، لانه بالكبار السن او بال يعني يونج ايج جروب تكون الايرويز عاده تكون اوسع، زين، الاناتومي مالها احسن، فتتحمل هذا الانفلاميشن او هذا السوالف. زين. هنا عندنا هذا اللارنكس، وهاي هي الفوكال كورد، زين، وهاي هي السنجرز بوليب او اللارنجيال نوديول اللي يصير بسبب الاريتيشن او بسبب الاكسسيف يوز اوف فويس. زين. هاي واحده من الباثولوجيز اللي تصير كلارنجيال تيومرز. زين. لارنجيال تيومرز يعني الاورام اللي تصير في منطقه اللارنكس، يا اما تكون بيناين تيومر او تكون مالجنانت تيومر. البيناين تيومر مثل اخذنا واحده من عندها اللي هي الفوكال كورد بوليب، زين، او السنجر نوديول يسموها، اللي هي سببها الاريتيشن والاكسسيف يوز اوف فويس. وعندنا ايضا اذر تايب اوف بيناين تيومر هو البابيلوما. بابيلوما ليش سميناها بابيلوما؟ لانه هي تكون مثل الفينجر لايك بروجكشن، هاي تشبه اصابع اليد، زين، فتكون على شكل فينجر لايك بروجكشن. زين. فناخذ الفوكال كورد بوليب مثل ما قلنا، هي smooth protrusion less than 0.5 cm in diameter, usually located in the true vocal cord. It is composed of cores of edematous fibrous tissue, which is covered by certified squamous epithelium containing chronic inflammatory cells. ومثل ما حكينا it usually occurs in heavy smokers أو تصير بالسنجرز، يعني الأشخاص يستخدمون صوتهم بكثرة مثل سنجر نوديول، وسببها هو الكرونيك اريتيشن، سواء كان عند الاشخاص اللي يستخدمون صوتهم بكثره او بسبب السموكينج، راح يؤدي الى chronic irritation بالميوكوزا وتؤدي الى formation of this scalp. The other benign tumor هو squamous cell papilloma اللي هي عباره عن papillary projection, usually ايضا arrive with two vocal cord, soft pinkish mass, rarely more than 1 cm in diameter. It consists of multiple finger-like projection of fibrovascular core which is covered by stratified squamous epithelium. راح تكون على شكل finger-like projection of طبعا fibrous tissue, fibrovascular tissue with lined by stratified squamous epithelium. You can see من هاي الجهه احنا شفنا البيناين تيومرز مثل النيزل او الفنجر نوديول والبابيلوما. تلاحظون انه هي تكون سموث راوندد، هنا small size، زين، هنا صح finger like projection لكن again is يعني small structure or small mass. بينما تلاحظون الكانسر او carcinoma of the larynx تكون larger in size, irregular in shape, more invasive and more destructive to the tissue surrounding it. زين. وهذا هو اللي نسميها cancer of the larynx. زين. سرطان الحنجرة. زين. هذا سرطان أو carcinoma of the larynx usually occurs at the age of 40 and male more than female. يعني هنا عندنا هذول التيومرز هم benign tumors اللي هي single nodule papilloma، وهنا راح نناقش malignant tumor، زين، الأورام السرطانية، زين، اللي هي carcinoma of the larynx. The causes of the carcinoma of the larynx, the most important causation هو السموكر. يعني أهم كوز لسرطان الحنجرة هو السموكرز، التدخين. زين. ومن النادر جدا ان نشوف سرطان الحنجره عند الاشخاص الغير مدخنين. زين. الا اذا اللهم عندهم الكحول intake او الاسبستوس exposure sometimes also play a role، لكن it is almost always occurring in those who are smokers، لانه السموكينج والتدخين والدخان اللي يجي من السموكينج كله راح يسوي irritation بالجلوكوزا. زين. راح يدخل عن طريق اللارنكس ويحفز السيلز انه ممكن بعض الاحيان تتحول الى malignant cells نتيجه الكارسيجينيك سبستانس الموجوده بالجسم. الهيستولوجي مال كارسينوما اوف ذا larynx it is 95% they are squamous cell carcinoma. هي عباره عن squamous cell carcinoma. ليش؟ لانه اكو عندنا normal epithelium باللارنكس هو عباره عن squamous epithelium، وحتى respiratory epithelium نتيجه السموكينج راح يصير في ميتابليجيا ويتحول الى squamous epithelium. فبالتالي السموكرز عاده الابيثيليوم الموجود هو squamous epithelium، فالكانسر اللي ينتج عنه هو عاده يكون squamous cell carcinoma. Rarely it could be adenocarcinoma. نعم it could be rare انه ممكن تكون على شكل adeno، لكن هي most common 95% of the carcinoma of the larynx they are squamous cell carcinoma. The location of this tumor inside the larynx, it could be either at the level of the vocal cord, we call it glottic tumor, or it could be above the vocal cord, we call it supraglottic, or it could be below the vocal cord, we call it subglottic tumor. تلاحظون هذا عندنا اللارynx، هاي مفتوحه اللارynx من الخلف. تلاحظون انه احنا عندنا 3 ليفلز باللارنكس. اول ليفل هو مستوى الفوكال كورد، هنا تقريبا هو مستوى نورمال فوكال كورد. المنطقه اللي فوق اللي فوق الفوكال كورد نسميها سوبرا جلوتيك اريا. المنطقه اللي هي تشمل الفوكال كورد نسميها جلوتيك اريا. المنطقه اللي هي تحت الفوكال كورد نسميها سب جلوتيك اريا. فعندنا سوبرا جلوتيك، جلوتيك، وسب جلوتيك اريا، كلها لارنكس وكلها ممكن تتعرض الى malignancy. زين، لكن we have 3 different areas اللي هي اما glutic او supraglutic او subglutic area of squamous cell carcinoma formation. اوكي، carcinoma of the larynx usually presentation مال سرطان الحنجره شلون يكون؟ يكون عاده على شكل hoarseness of voice. يجي الشخص يقول لك والله انا عندي بحه بالصوت، زين، يعني صار لي زمان صوتي مبحوح، اخذت علاجات كثيره وما فاد، زين. وممكن ايضا يجي على شكل ويت لوس، يجي على شكل يعني ملز والى اخره من confusional features. 90% of the glutic tumor they have excellent prognosis، يعني يكون عاده البروجنوز مالها احسن من غيرها. ليش؟ لسببين. السبب الاول انه الجلوتيك تيومر it will affect the mobility of the vocal cord. فاذا البيشنت اول ما يبدي عنده التيومر لانه جلوتيك تيومر ياثر على الفوكال كورد، راح يصير عنده بحه بالصوت، فالمريض راح يراجع بشكل اسرع. زين، راح يراجع بشكل اسرع الى المستشفى او الى الطبيب من الشخص اللي ما عنده اعراض بالصوت، زين، او ما عنده مشكله بالصوت. فاذا لانه تؤدي الى بروبلم بالفوكال كورد يعني موبيليتي، فبالتالي راح تؤدي الى يعني early presentation to the doctor، ومن ثم early investigation يسووا له ناظور الحنجره، ويفوتون الى الحنجره والى منطقه الفوكال كورد عن طريق الاندوسكوب، عن طريق الناظور اللي هي عباره عن مثل يعني صونده تدخل الى داخل اللارنج وفيها كاميرا، وهاي الكاميرا راح يشوف بها اخصائي الاي ان تي، راح يشوف منطقه اللارنج ويفحصها كلوسلي. اذا شاف اكو ماس او شاف اكو ليجن راح ياخذ بايوبسي، راح يسحب مثل مثل يعني ملقط، راح ياخذ نتفه من هاي الماس، زين، ويبعثها الى مختبر الانسجه حتى يشوف انه هاي الماس اللي هي بيناين او مالجنت. بس طبعا هو عنده فد امبريشن، يعني هو كوسلي انه هاي قد تكون مالجنت او بيناين، فيعطينا الامبريشن مالته. واحنا ايضا نشوف السلايد على الهيستولوجي ونحاول ايضا نعرف اذا كانت الماس هي بيناين او مالجنت. فاذا هي تاثر على الموبيليتي اوف ذا فوكال كورد، وايضا انه منطقه الجلوتيك اريا ما بها ليمفاتيك سبلاي، فبالتالي الجلوتيك تيومرز الليمفاتيك سبريد مالتها والميتاستاسيس راح يكون ليت. ليش راح يكون ليت؟ لانه ما عندنا ليمفاتيك بمنطقه الجلوتيك اريا، فبالتالي راح يتاخر الورم لحد ما ينتشر. زين، هذا على عكس السوبرا جلوتيك او حتى السب جلوتيك تيومر اللي تكون عاده فيها ريتش ليمفاتيك سبلاي، زين، وبالتالي يكون الميتاستاسيس early. Again, the supraglutic tumor either remain silent and the patient presenting lately، لانه التيومر ما راح ياثر على الفوكال كورد، فممكن المريض ما يراجع المستشفى الا بعد ما تتفاقم حالته او تسوء حالته، فعاده يجي المريض بشكل late presentation with poor prognosis. فاذا عرفنا الجلوتيك tumor they have better prognosis than the supra or even the subglutic tumor because of early presentation to affect the vocal cord and because there is no lymphatic supply. بينما السوبراجلوتيك تيومر عاده عندنا بها ليمفاتيك وما تاثر على الفوكال كورد موبيليتي، فيكون البرزنتيشن مالتها ليتي. لاحظون هاي هي الناس، هذا المالجنت تيومر شلون يكون irregular destructive sometimes يعني areas of hemorrhage you can see This is a rapidly growing mass then يؤدي إلى invasion destruction وممكن حتى يسوي metastasis إلى ال other organs يروح إلى اللانج يروح إلى البرين يروح إلى الليفر إلى any other organ زين فلذلك احنا نسميه malignant tumor carcinoma of the larynx زين وتلاحظون الهيستولوجي مالته تلاحظون الخلايا تشبه السكويموس ابيثيليا فسميناها سكويموس سيل كارسينوما موجوده بشكل irregular distribution and invasion and destruction of the surrounding tissue and this is the normal epithelium اللي موجود باللارynx وهذا هو المalignant tumor الموجود في التشو of the larynx هذا هو المalignancy of the larynx طبعا لحد الان انا خلصت الupper respiratory tract pathology زين ان شاء الله في محاضره اليوم ان شاء الله في الساعه 12:30 راح نكمل معاكم نبدي باللنج ان شاء الله يعني خلصنا احنا في الابر ريسبيراتوري تراك راح بعدين نبدي باللنج يعني من اللور ريسبيراتوري تراك راح نبدي باللنج ان شاء الله اليوم راح ناخذ بعض التيرمز مثل اي ار دي اس وراح ناخذ الاوبستراكتيف اير واي ديزيز راح نفهم شنو الاوبستراكتيف وشنو الريسبتيف ونبدي ان شاء الله بالاوبستراكتيف اير واي ديزيز موعدنا ان شاء الله ب 12:30 ما اعرف اذا احد عنده سؤال او استفسار او كومنت على المحاضره ممكن يكتب بالشات او اذا حد يفتح المايك ان شاء الله حنغطي الريسبيراتوري سيستم في 5 محاضرات يعني هالاسبوع كله والاحد الصبح ان شاء الله تكون اخر محاضره ريسبيراتوري سيستم ان شاء الله الاحد الظهر يعني مو اليوم احد القادم الظهر راح تبداون ان شاء الله يعني الجي اي سيستم مع الدكتوره زهراء ان شاء الله يعني اذا مشت الامور يعني مثل ما مخطط لها بس ان شاء الله احنا مقررين الريسبيراتوري سيستم على 5 محاضرات ان شاء الله وانا نزلت ال5 محاضرات كلها على الكلاس ممكن من هسه تشوفوها وتراجعوها او تطبعوها عندكم زين ويعني تقرأوها او تاخذون فكره عنها او تبشرون خلال المحاضره هذه اذا اكو سؤال او كومنت اوكي اذا نلتقي ان شاء الله ب 12:30 في نفس البرنامج ونفس الباسورد اوكي ثانك يو